Gentlemen, let's cut straight to the chase. I want you to imagine waking up tomorrow morning with the kind of powerful, dependable firmness you haven't felt in years. I'm not talking about expensive pills, clumsy pumps, or risky treatments. I'm talking about a simple, completely natural technique you can do with nothing but your own hands in just a few minutes to wake up your body's natural erection mechanism. I'm Dr. Nerita, and I've spent the last 12 years as a urologist guiding men just like you, on how to reclaim their vitality, their energy, and their sexual confidence. If you've been missing that automatic, reliable morning rise, or if things just feel softer and less responsive than they used to, you need to stay with me. Today, I'm going to reveal 3 specific, hidden pressure points on and around your manhood. When you stimulate these spots safely and precisely, you can help restore those morning erections by radically improving blood flow, relaxing key muscles, and sharpening nerve responsiveness. By the end of this video, you'll know exactly where these spots are, how to work them, and why this simple, drug-free routine is one of the most powerful steps you can take toward feeling completely like yourself again. Do me a favor right now. If you've ever felt frustrated or worried about this topic, please hit the like button. It's a simple click, but it tells the YouTube algorithm that this crucial information needs to reach more men who are struggling silently. And drop a comment below. Tell me, what's the biggest barrier to your vitality right now? We're a community here. Before we even touch the first point, you need to understand the science of why this works, because it's far more profound than just pressing on skin. The truth is, erections are not mechanical. They are the result of a perfectly coordinated, lightning-fast dance between your brain, your nerves, your muscles, and your blood vessels. A healthy erection starts with a powerful nerve signal, an electrical message that races down from your brain or sensory nerves, telling the smooth muscle in the penis to relax. This relaxation is the open door that allows blood to rush in and fill the spongy chambers, corpora cavernosa, trapping the blood inside and creating firmness. The age-related double hit. Here's the myth we need to bust. The fade isn't just part of getting old. It's a solvable biological problem that we can address. After 50 or 60, 2 main things are slowing down. Sluggish circulation, the plumbing problem. Over decades, arterial walls can lose their elasticity and stiffen, a process called endothelial dysfunction, often accelerated by mild inflammation or high blood pressure. Your vessels can't open wide quickly enough to get that massive, firm rush of blood. Weaker nerve signals, the wiring problem, nerve conduction slows. Those tiny electrical messages that say, go time, don't travel as strongly or as quickly as they used to. This double hit, stiff plumbing and slow wiring is why that automatic morning response starts to disappear. How pressure points reset the system. Targeted pressure point stimulation is a brilliant way to bypass some of that age-related lag. When you press or massage these specific spots, you do 2 immediate, powerful things. You send a direct wake-up call through your sensory nervous system. These signals feed straight into the erection center in your lower spinal cord. You reflexively relax the smooth muscle in the arteries, encouraging blood vessels to widen and allow blood to flow more freely. Think of it like this. If your computer is running slow and lagging, you don't buy a whole new computer. Sometimes you just reset the signal. These pressure points are your body's reset button for the erectile reflex. Doing this regularly can actually help retrain your reflexes and improve vascular flexibility over time. I want you to know this comes from a place of deep experience and compassion. For 12 years, I've been sitting across from men who describe the emotional toll of losing their morning vitality. It's not just about sex. It's about a man's dignity, his self-perception, and the freedom of knowing his body still works. Emotionally, when you lose that spontaneous morning rise, it creates doubt and anxiety. This routine is about replacing doubt with comfort, freedom, and renewed confidence. It's about feeling like a younger, more responsive version of yourself. Practically, this routine takes less than 7 minutes and requires 0 equipment. It fits perfectly into your morning routine, giving you a powerful, drug-free tool that is 100% in your control. Now, let's unlock these 3 essential pressure points that can help you take back your mornings. Make sure you are subscribed so you don't miss the next video. We're starting at the root and working our way to the most sensitive area. Remember, this is about gentle, firm, intentional stimulation, not pain. 3. The control hub, the base groove. This point sits right at the root of your manhood, the exact spot where the shaft tucks into and meets the pubic area. To find it, run your fingers along the underside of the shaft toward your body. You'll feel a slight groove or natural hinge where the erectile tissue anchors deep in the pelvis. Beneath this innocent-looking groove is a dense convergence of nerves and major blood vessel junctions. The biological explanation: nerve and vascular converge. This area houses branches of the dorsal nerve of the penis and key arterial branches. Think of it as the main switchboard where the nerve signals from the spinal cord meet the vascular signals that open the floodgates. When you stimulate the base groove, you are essentially sending two synchronized messages: wake up the nerves and open the arteries. This dual action primes the entire erectile tissue to respond faster and more completely to any arousal signal, whether it's from your brain or the natural physical processes of waking up. The emotional effect: priming the engine. Applying gentle pressure here gives you a hands-on connection to your own body's potential. It's a tactile reminder that your body is still responsive. Men report feeling a subtle, pleasant warmth or fullness starting here, a physical confirmation that blood flow is improving, instantly boosting mental confidence. The practical application: the technique. Position your thumb directly over the groove while your fingers cradle the shaft for support. Apply moderate pressure enough to feel the tissue underneath, never painful. Use slow, deliberate circular motions for about 90 seconds. You might feel a subtle tingling. Over time, daily practice here heightens the sensitivity and makes the tissue more responsive to the morning reflex. 2. The hidden clamp, the perineum spot. This is the point most men overlook, but it's an absolute powerhouse for strength and firmness. The perineum is that soft, slightly springy patch of tissue located between the scrotum and the anus. Why is it the hidden champion? It sits directly above the bulbospongiosus muscle. The biological explanation: the muscle clamp. The bulbospongiosus is one of the key muscles of your pelvic floor. It's the muscle responsible for the final, crucial step of an erection, trapping the blood inside the penis once it has rushed in, making it feel solid and dependable. Think of it as a natural clamp. Like any muscle, if it's not engaged, it weakens over time, leading to erections that feel full, but then quickly fade, venous leak. By applying targeted pressure to the perineum spot, you reflexively activate this crucial muscle, giving it a gentle workout without even doing a full set of Kegels. This not only helps in the moment, but trains the muscle to contract more powerfully when you are aroused, making your erections fuller and more sustainable. The emotional effect: foundation of strength. Knowing you are directly working on the muscle that holds firmness is incredibly reassuring. It shifts your focus from worry about getting an erection to confidence about maintaining it. It's a feeling of structural integrity and control returning to the area. The practical application: the technique. Sit comfortably or lie back with your knees slightly apart. Use 2 fingers, index and middle are usually best. Press gently but firmly into the center of the perineum. You should feel the underlying tissue respond, but it should not be uncomfortable. Move your fingers in slow, deliberate circles for about 2 minutes. You might feel a gentle pulsing as deeper circulation improves. For an added boost, try lightly contracting your pelvic floor, a Kegel, while you massage this spot. The synergy is powerful. 1. The sensory amplifier, the glans ring, corona. Our final point is the most sensitive area, right beneath the head of the penis, specifically the ring-like ridge where the glans meets the shaft, called the corona. Why save this one for last? Because it's your body's most direct line to the erection center. The biological explanation: nerve reconditioning. This area is packed with the densest concentration of sensory nerve endings in the male body. These nerves are your body's main messengers for sending instant arousal signals straight to the spinal cord. After years of reduced stimulus or nerve slowdown, they can become sluggish. Controlled stimulation here is like tuning up your body's arousal circuitry, resensitizing the nerves so they fire and transmit signals more efficiently, making the transition from arousal to a full erection smoother and faster. It's about gently reconditioning the nerves to respond the way they did in your younger years. The emotional effect: spontaneity and vitality. Increased sensitivity here means arousal feels more natural and spontaneous. This isn't just about a physical response. It's about reconnecting with a feeling of vibrant vitality and responsiveness that contributes greatly to a man's emotional well-being and his freedom from performance anxiety. The practical application, controlled technique. This area works best with controlled rhythmic stimulation. Phase 1, hold and release. Gently take hold of your manhood with your thumb and forefinger on either side of the corona. Lightly pinch the ridge and hold for about 5 seconds, then slowly release. Repeat this hold and release for about 60 seconds. Phase 2, circular stroke. Then switch to slow, gentle circular motions around the entire circumference of the corona for the second minute. The goal is to stimulate the nerve endings without causing friction or irritation. Remember, this is not about overwhelming the nerves, it's about awakening them. The very best results happen when you treat these 3 points not as isolated tricks, but as a single, powerful, intentional routine. Setting the right expectation. This is not a magic button that works tonight. Your body needs time to adapt, to retrain those blood vessels, muscles, and nerves to work together again. However, many of my patients start noticing subtle but encouraging changes within just 2 to 4 weeks. Improved warmth and fullness in the mornings, erections that last a little longer, and a general feeling of increased vitality in the pelvic area. The multiplier effect. For truly lasting improvements, you must pair this daily pressure point routine with healthy habits. Stay hydrated. Good blood flow requires good blood volume. Drink enough water. Kegels. The pressure point on the perineum activates the muscle, but regular Kegel exercises actually strengthen it. Do them throughout the day. Nutrition. What you eat fuels your blood vessels. Focus on whole foods that support nitric oxide production. When you make these steps part of your daily rhythm, the benefits multiply. The points become more responsive, circulation improves, and your body begins to remember how to perform the way it once did. Gentlemen, please internalize this. You do not have to accept the gradual disappearance of morning erections as an inevitable, irreversible part of aging. Your body still has the ability to respond. It just needs the right signal, the right stimulation, and the right support. I see men in my practice every day who have let anxiety and disappointment erode their sense of self. This simple, hands-on technique is not just about physical function, it's about taking back control. It's about performing a small, daily act of self-care that reminds you that you are capable, vital, and strong. There is immense dignity in choosing drug-free, non-invasive ways to optimize your own health. By pressing these 3 points daily, you are retraining your nerves, restoring circulation, and bringing back that morning confidence, all completely within your control. You have just learned a powerful, ancient technique rooted in modern urological understanding. You've learned how to literally put the power of reclaiming your vitality back into your own hands. Your sexual health is a direct reflection of your overall vascular health. Every step you take toward better blood flow, better muscle tone, and sharper nerve function will pay off not only in the bedroom, but in your energy, your focus, and your overall confidence. You are not destined for decline. You are capable of amazing things, and the path back to feeling great starts with the simple choice you make tomorrow morning. Your final assignment is this. Commit to the 7-minute morning reset for the next 30 days. Just commit to a month. Come back and comment on this video in 4 weeks and tell me what subtle difference you've noticed. Your experience is going to be the light for another man who needs hope. If this video gave you that confidence boost you needed, subscribe now for more Real Talk health advice, and share this with a buddy who needs to know his body is still capable of amazing things. Until next time, this is Dr. Nerita, reminding you that small, consistent changes are the foundation of lifelong vitality. Stay strong, gentlemen. You deserve to feel great.